get up.
Boy, I hungry.
Wait, come see that.
Take advantage of Perky's Pizza's college student discount. Spend $10 to $50 and get 10% off, or spend $51 and up for a 15% discount. Flash your ID and save big today.
Hello. Good evening. Welcome to another show. I did promise you guys that I will be on 3 times this week. 3 times, thrice. We had a show on Monday, had a show on Tuesday, had a show on Wednesday. Let me tell you, I have the hardest working producer on the planet, and Smart was determined to have a show every single day this week. And it doesn't matter how tired I felt. No, Smart just believes in what we have to do. We have a job to do. Samaj. Today I was like, Samaj, we really having a show tonight? Yes, Jael, we're having a show tonight. Welcome, guys. Welcome. Share the live. What are you like? What you waiting for? Share the live. Once I come on here, share the live. Hit the share button. Let the whole world know we're gonna be. Listen, we're gonna be. You know my platform. My platform has 72% women on my platform. 72%. Imagine that, eh? 72% men don't really like me. That's okay. 72% of my following are made up of women or people who identify as women. And yesterday we had a men's mental health show. We had on Lester Guy, and we also had on Shervin Dominic. Well, Shervin Dominic was the one who brought it up, and I encouraged it, and I believed in what he was trying to achieve, and I felt like the show was a really good one, and I hope that I could do this again another time. If you missed the show, you can go on my YouTube page and you can check out the show. He made some comments, and Jael will fight. We'll fight. Talk about things like ganja. We have a discussion, right? So the conversation was very interesting, and I've invited Mr. Guy to come back on the show at another time, to see if we can continue or we can tweak it, or what we can do, in terms of men's mental health and all things to do with medicine. Tonight we have Dr. Roberts, and we're talking women's health tonight. Share the live. I don't think I have to tell you to share the live. When you come on here, share the live, tag a friend, tag a woman in your life. If you have women that you ride for, that you love, that you appreciate, we're going to be talking about something that is a very, very pertinent and prevalent in our community, especially as women of color, right? And I want us to open our minds and open our hearts and open our ears, our Zoe, to receiving what Dr. Roberts. Dr. Roberts is one of the doctors in the. I know a lot of doctors, but I can count on one hand how many of them I give a damn about. One hand, and Dr. Roberts is on that hand. Okay, because it is what it is. I'm a funny kind of a person, and I believe in what her work. She's a gynecologist. She's been my doctor for quite some time. As a matter of fact, when I got pregnant with my last, she found out. Girlfriend didn't even know she was pregnant. Huh? Doctor was saying, Jael, imagine I lie down there on the bed and she goes, then I think you're pregnant. I say, what? How that happened here? I was like, no, you gotta be kidding me. I just come to get a routine checkup so I can get insurance, and my girl is telling me I am fat. Listen. And we had made this whole plan. We're going to put the the test in the. I don't know if she remembers. She laughing in the back. We put the test in an envelope with wrapped around a picture of a woman's uterus, and we wrapped it and we put it in the envelope, and I put it on the seat of my car. I was picking up Joe, and when I picked him up, he sat down on it. And he said, "What is that?" And he picked it up. He goes, "What is that?" And he looked in it. And yeah. And jazz came about. That's how jazz came about on the scene. That is how jazz came about. But Dr. Roberts is what I mean. I just recently I visited her again. And we'll talk a little bit about why I visited her. Because I don't really hide these things. I know in Dominica we have this thing like we like to hide. Not Dominica, no, I think it's a West Indian thing where we like to hide if we're sick or if we're ill, like we feel like it's nobody's business and whatnot. And I don't understand it because I feel like if you're ill and you have people who love you, or at least there are people in your life, why won't you tell them so they can support you in whatever way? But I also think too that sometimes when people find out or hear about you being sick, they always say, Ella, Ella, like Ella what? Like sometimes people bring their pity party with them because some people just miserable and sometimes misery loves company. And they will just want to make you feel some type of way. However, I believe that your community is there to help you through the good times and as well as the tough times. Whether they help you with kind words, words of encouragement, whether they help you with l'argent cherche, whether they help you with flowers, that's what your community is there for. And I don't feel like it's something that we need to keep a secret. If we're ill or if we're going through something. I mean, I don't expect you to go and blast on social media and tell everybody your business, but your family, your friends, and don't feel no way about it. Like I don't see the big deal. But that's just me, okay? Probably because I'm an open book and I'm a dash so I don't really care what anybody thinks about me. I'm give it to you on the rocks with no chaser. So we got Dr. Roberts in the house. He's going to be joining us. I want to say thank you very much to all those of you who are tuning in. I love to see y'all tagging Avril, tagging her whole family. Every woman she know, Avril can tag. Big up to you, Avril. I see men are also tagging women on the live. It's so good to see this happening. I'm loving this. I'm really loving this. Keep tagging your friends. Keep sharing the live. Keep letting people know to come on down, come on in, and show some love and support the vibe and get some information. And you could even ask questions. Sometimes you don't want to ask questions because you're afraid that or you don't want to go to the doctor because you're worried. And ask a question, and hopefully the Dr. Roberts can answer you. And if she can't, you can just go to her office. Doctors in Dominica, they don't promote themselves, but this is me doing my shameless plug. You can always go to her office. and appointment, you can call her up and book an appointment and go visit her. I want to say thank you very much to the National Cooperative Credit Union and Mickey's Pizza for coming on board and showing their love and support of my show. I want to specifically, saying thank you so very much to the NCCU. Let me tell you, NCCU does not waste any time when it comes to supporting what I do. I don't know about other people, but what I do, and I truly appreciate them. They are my financial institution of choice. That is where I do my banking, or that is at least one of the institutions I do my banking. But I really love the NCCU and what they represent. My mother introduced me to the NCCU, because at the time it was just credit union when I was a little girl. And I encourage my kids. They both have accounts at the NCCU to save. Summer's coming up, and a lot of you are watching, and you're probably saying, "Yeah, I probably have money. That's why she can save at NCCU." All you need to do is give them $5 and make them put it on their book. $5. Somebody was telling me if you did $5 a month from the time you were, I don't know, I have to calculate that to make sure. So don't quote me. That you will have, I think, how much thousands of dollars by the time the child hits 18. I actually never really looked into it, but I believe that is quite possible. So check out the NCC, you guys, and open a savings account for your kids during the summer. Teach them to save. Let them know the importance. Giovanni's going to be working this summer, and I've already said to him 10% of everything 10% of whatever money you make this summer is going into your NCCU account. right? And I just want to say thank you to them for supporting. You can definitely use your NTCU card on CU online. You can swipe worldwide. I mean, it's your money, your way. The NCCU is your NCCU, right? So I want to big up the NCCU one time. And also thanks to Perky's Pizza. If you're craving pizza, you skip the line. Perky's is definitely our household's favorite pizza. We cannot do it on Perky's. Every Friday is Perky's Pizza Friday in my house. And I know the kids are looking forward to Friday every single Friday. Sometimes they want it in the weekday. And I have to tell them, you know what, that's enough. Thankfully, they have a very high metabolism. So they make those mayo come manger pizza as the day can go in. And it's summertime. I know a lot of you are going to have kids home. So you can be at work and you can order pizza and get it sent home, especially if you're in the Roseau area at perkyspizza.online. We're ready to roll. We're ready to have Dr. I'm excited to have her on. I cannot wait to speak to her. We're gonna get it. I want to shout out the folks who are on the live, those of you on YouTube, those of you on LinkedIn, those of you on Facebook. Good evening to you. I want to encourage you, if you're logging on here and this is your very first time, please go to my YouTube page, and that is where I want you to be watching this show, because you know what happens in a month? Facebook taking this down. Will take this down, and I need you to view it on a YouTube, because that is where majority of my shows were positive when we come back for the new season. And guess what, guys? Today is the last show of my season. The last show, Dr. Roberts are wrapping it up with women's health. The last show. So when we come back next season, we're going to be mostly on YouTube. And I want to encourage you guys, if you've not done so yet, subscribe. It's not going to take out no blood from you. I'm not asking you for your card information. I'm not asking you to love. I'm not asking you for nothing else but just to hit subscribe and support by following, listening, viewing. Turn on your notifications so when I go live, you know exactly what I do. All right. So we're getting ready for Dr. Robert, who's in the house. She's here already. She was bright and early. She came on. I want to say a special good evening and welcome to the show I think it's the very first time, for the very first time. Hi, Dr.
Hello.
Roberts. How are
And it's
you?
$1,000, 1,080 if you put $5 a month. Just five. Well, imagine if you put more.
How much it is?
1,080. Just for $5. Not bad, eh?
So you did
add
the
up your-
calculation.
Of course. And I remember the test. Yes. Uh, can you hear me? Mm. Did I what? I didn't hear you.
I don't know what's going on. I don't know why that thing being stupid.
It's on your side, actually. It's from the time you were talking, there was a bit of a delay.
Lost you. All right, guys. I don't know. My internet is I'm having some serious internet
Yeah,
issues, and it can't try me. Dr. Robert, you're back, right?
I hope so.
Okay, good. Good. Where were we? You said you remembered when
Your test, I remember
that
the
was
drama.
hilarious, right? It was drama because I wasn't expecting it.
Yes,
I
it
came from
happens.
a routine physical, and boom, bada, boom,
Yes.
bada, bing. You were like, how did you know though? Like, how did you know?
Sometimes you just know. I remember I had a young lady who had a bad taste in her mouth. It just wouldn't go away, just like a metallic taste. I can't remember what she said, and on going on. And I said, well, let's do a pregnancy test. And they said she had polycystic ovaries. I can't get pregnant. And I said, well, let's see. She never came back. She never came back. But yes, I laugh.
The thing about it is that you didn't do you were just touching my stomach, and I like
Yes, I guess with what you say,
but
what you said was happening. I
I
make the
was
connection.
but I wasn't really
Maybe
going.
you have realized the situation of the last period or something. I'm listening as you talk. I listen to you.
I honestly don't recall. All I
Yeah.
remember is that all I remember what was going on in my life at the time. I was getting ready
Right.
my 767 Girls Rock show. By the way, it's streaming on 767 Girls Rock as well. So I was getting ready for that show. I
Mm-hmm.
had just learned, so Sagico had come on as a sponsor, and I had just learned that they had a policy that they were grandfathering. And I was like, when I looked into the policy, I was like, boy, I need to get on that policy ASAP. So I asked them if how what do I need to do? And when they checked, because I have another policy with them, they were like, well, your last checkup was 5 years
You need
ago.
a medical.
You need to do a medical. So that's when I'm like, when are you thinking? They tell me Friday. I was like, okay, after I called you guys up and I booked my appointment and I was in. And
An early appointment, no long delays.
no
Don't like
long,
what they say.
no long,
I
and
have
I
to put
was
that in there.
and I was in, and then when I left, I was just like, but
I
what's
remember the paper. I remember the paper I wrapped it in. It was a big uterus model on
this?
the paper.
You like drama. I love it. I love it. You made it exciting. And that is really appreciated because some doctors can be a bit old fashioned and they'll just start drilling you and telling you what you need to do and what you don't need to do. But you made it fun. You made it exciting. You played along because I was like, oh, we need to surprise him and all of that. And it was wonderful.
Yes, yes.
But it's great to have you here on the show.
Thank
Like I said, you're one of my favorite doctors in Dominica, and I truly appreciate you coming on, taking the time out of your busy schedule because you have plenty babies sometimes delivering. You
Not,
have
yes, yes.
not
Only
babies.
3 years.
She's like,
No
honey,
babies anymore.
but you are so super busy. Like even getting you on the phone sometimes can be difficult because you are very busy. You're a high demand doctor, and I'm glad that you could come on. And I believe I want to kind of introduce why we are here, why we need to have this conversation. Because yes, we're talking about women's health, but we want to zone in specifically on fibroids, because that is something. What
You changed.
what are we talking about?
Polycystic ovaries and menstrual hygiene. Hmm.
Let's talk about fibroids.
We can talk about anything.
But you tell me you want to talk about fibroids.
Moche. Let me, Lord. You gave me something else to talk about. I'm ready to talk about that other thing. I'm just putting your feet.
Samaj gonna knock me down because I was like, Samaj, we're gonna talk about this, we're gonna talk about that. But Dr. Roberts, honestly, I
No,
think
you said me an idea what you wanted to talk about, and that's okay. That's
yes.
fine. One of these
So
days
I
I'll
think
do a
I
topic
think we
on
could.
fibroids. Yeah.
Okay, wonderful. So I want us to touch on obviously polycystic
Yes.
ovaries and all of
Yes.
those things. But recently I came to you um just recently this year, as a matter of fact, to do a mammogram. I will, to get checked up and whatnot. And I know, like Dominica, you know, we have the tendency, and a huge part of it is of the because of people's financial standing. So they might say, "I'll wait until I get sick before I can go to a doctor," instead of going to a doctor first to check
Before.
your
Yes.
annual checkup. But I think because I became an adult in Canada and I got accustomed to going every year because it's
Taking coverage.
mandatory that you go every year. Your doctor will call you and your doctor will tell you when's your appointment. You go in because the health system does not want to strain on them. So they ensure that they find out things early,
Screening.
so
Very
it's early
important. Yeah.
screening, rather than not. And my doctor in Canada had informed me last year that I would be coming due for a mammogram. And then I started to feel like a lump. but I do have lumpy boobs, which we've spoken about, you and I have lumpy boobs, and I was not, it wasn't a surprise to me, but just one specific breast was a little bit more sensitive, and I reached out to you. I scheduled an appointment, came in to see you. We spoke a little bit about, what could be causing this and whatnot. And I did tell you, I was due for a mammogram and whatnot. You said, well, honest to God though, I would, without tripping you, I've had a mammogram before, and my best experience of having mammogram is in Dominica. And I don't even know if it's just probably because they know me or what it is, but it's still painful. Like when they hold that and oh my God, when they,
Well, every breast is different. Everybody's pain tolerance or discomfort tolerance is different. So it's not
but it's the
really
small,
painful, much less like you, and it wasn't painful for me. So it depends on the
yeah.
person, the breast.
So it
I think
wasn't it wasn't like a long, like it's not something that's hurting you after the fact. It's just in the
correct,
moment you feel it.
correct.
Yeah, it's like
And you
a
feel very vulnerable and exposed there because they're putting your boobs in a machine, and you have to be
and
all
squeezing.
undressed, and you're pushing it there, push it here, push it there.
Yeah, and the
But yeah,
radiologist, she's like
a
she
bit.
goes underneath, like she goes under,
I
and
know, yes.
she like
All in your business, yes. But it's done very well.
it
So
is
she
done
makes it
very
very
well. Very well. And
yes.
I love the fact that they told
Yes.
me, that um in the event that they find anything, I may have to come back for an
Do an
ultrasound.
ultrasound. That's the one thing about medicals. They will tell you that they will give you an idea that they might do an ultrasound. Doesn't necessarily mean something is wrong. And I
Hmm.
reinforce that with the patients as well, because everybody thinks as soon as you going to check something else, something might be bad. But it's not that. Sometimes the detail is seen, yes, with the mammogram. It's the gold standard, yes, but sometimes the type of breast requires another look. And so
Hmm.
they give you a little ultrasound, which is great. It's
Yeah,
not
and
an extra charge.
I ended up having to, and it's not an extra cost, which is,
Mhm.
let
No,
me tell you, you pay for your
wonderful.
mammogram and then
Wonderful.
the thing. It's something though I really want to encourage folks is in Dominica, women in Dominica, to please try and see a doctor once a year. Like I really want to encourage that because it's
Voice agree.
benefited me. I
Mhm.
found out I was pre-diabetic last year when I went to my doctor for my annual checkup in Canada. And hearing that I was pre-diabetic forced me to do something about it in that moment. Like I was like, I'm going to lose weight, I'm going to change my diet, I'm going to cut out things. So, but we find so many women in Dominica are missing the pre and just finding out they're diabetic. Like they just missing that pre notification because we're not
Yes.
actively going because
we,
we're taking
we we are still not looking out for ourselves and caring for ourselves and putting ourselves first. Sometimes we'll send our children, we'll send our husbands, we'll send our boyfriends, but we will not necessarily go to the doctor ourselves. We have to change that.
and that is rather unfortunate. I really want to encourage women, especially the women on the live, my gang, those of you that are my dashing leaves, please go to put because no, a doctor's checkup is how much, like $120,
Somewhere
150,
between 100 and 150 years.
give or take. So if you think,
Some doctors change if it's just a first visit or haven't been there in a long time. Yeah. But yeah.
put $15 away, $15 every month aside, and you will have more than enough to do a checkup,
Oh, yeah.
right?
Yeah.
You have more than enough to do an annual checkup. I really want to encourage that. And that's the message that I really, really want to share, even before we get into it. But I
And
want
we'll
to get,
talk about it.
yes, I want to get a little bit about you, why did you decide to become a doctor, specifically an OBGYN?
Hmm. Why? I think I always wanted to be a doctor. From since I was small. I think what the choices and the decisions in school to do science and different things always with that aim to become a doctor. And you ask, well, I have three other friends. Well, I had a group of six of us.
Hmm.
Four of us, Dr. Carlin Georgie, Gillian Lewis, Ruby Blanc, we wanted to do medicine from the get go. Our other two friends, Karen Chambers and Aretha Francis, not at all. So sometimes Aretha went into education, Karen went into HR. Everybody's passionate about what they do. So sometimes you know from the beginning, sometimes you have an influence. I didn't have any family members who were doctors. I had a elderly doctor uncle in Trinidad. I didn't know him very well, but I did not have any direct medical person in my family. A question that is asked at university actually: "Oh, do you have a father? Who's your dad? Who's your no? Just me." So I wanted to be a doctor all the time. With respect to doing OBGYN, um, I like medicine. When I did, I needed to do surgery. Surgery was very important to me. When I did my surgical rotation, I didn't have a good experience. I didn't have a good experience at all. And you recognize things that you like and things that you don't want to see all your life. Gynae was a perfect combination. Gynae and obstetrics, I got to deal with babies, healthy young patients for the most part, and gynecology, which is helping women, and an area that I find very interesting up to today. I mean, there are things that my mom wouldn't expect me to have been doing. I'm sure when you're doing medicine, they don't expect you to be dealing with certain things, but it's okay. So I like it still. When you're having a rough day and you're tired, at least you're doing something you like
That's
and
it.
that you will always want to do, you
That
know?
is that
And I'll
is
always want to educate. I like to educate young ladies and older ladies, it's just, sometimes coming on the radio on on your program. That's why I'm the last one.
that's for the
But
year,
yes,
for the
yes,
season. For the season. Yes,
yes.
yes. So
But
you
it's what I want to do always.
thank you for coming on, Dr. Roberts. In your practice, what are some of the most common issues you see coming in, like women come in with? Like, what are some of the things that you find the most
Well,
prevalent?
Well, routine-wise, people come in for their annuals, their pap smears, of course, and their breast screening. Outside of that, conditions that we get, menstrual condition, menstrual issues, whether it is that they have abnormally long periods or not getting a period, or they've been told they have cystic ovaries, like we're going to discuss, and infertility, wanting to get a baby, have a baby, and uterine fibroids is, oh, for sure, almost every other. But these are the common things happening in the practice. Yes.
Wow. You talk about PCOS, you talk about fibroids, and I want to talk. These are going to be the top things that we want to touch on tonight because we just have an hour and we don't want to keep you past an hour
I
because
got
we
a
may have
long
a busy
list. I'm
schedule.
ready for your long list.
But for those of us who don't know, what exactly is PCOS and how common is it among women today? I never knew about this thing, and all of a
Um,
sudden I just hear everybody talking about, oh, it's PCOS.
it's just more awareness. It's always there. It's just become people are more aware of it. Um, it's just a situation where or condition where the ovaries are cystic. There are lots of ovarian cysts. Um, they are what should I say, androgen secreting. They secrete hormones that give you male signs and symptoms, and irregular menstrual cycles, acne sometimes, increased hair growth, and it is androgen secreting. So it's just that enlarged ovaries, increased hormonal imbalance, and cystic. That's all it is. Exactly. There is no
Mm.
real genetic predisposition to it. You'll find that it's familial. Your sister might have it, your mother might have it, your aunt, and so on. But there's no gene that says this gene is going to make you have polycystic ovarian syndrome.
Is it also, it could it be connected to food and what we eat, like, and what is consumed? Because, like, do you think that is
Obese
something that is
is very, very common in patients who are obese, or having a BMI over 30. And it in itself as a condition encourages you to be obese. Okay, so that is one of the things that is very, very significant. People are very uncomfortable talking about obesity. People are, when patients are told about weight loss, they may feel a bit conscious or so, but it is just one of the most important ways of improving the situation. So yes, it's seen in about 10% of women. It's very, very common, and black women even more. So very, very common condition. The gynecological
Wow.
conditions are very common in the black women.
Hmm. Black women, we don't be telling like chin. We have things on our core. We have things to carry on that cross of
I
ours.
I
Oh,
know.
how does PCOS affect women's overall health, even beyond productive or reproductive concerns?
Well, first, with respect to the reproductive situation, the menstrual disturbance is very significant. I mean, you have this ovary that is normally this little size,
Mhm.
and then it becomes cystic. Lots of cysts. It becomes enlarged, so it becomes painful. So they develop a painful pelvis, pelvic pain, low abdominal pain, and these cysts are producing hormone, are attempting to produce hormone as well. So there is this hormonal imbalance that is going on. Insulin gets secreted excessively. When insulin gets secreted excessively, it's like you're in a diabetic state somewhat. This is why patients are sometimes given metformin. Metformin has been shown to work, even though it is a diabetic medication, it has been found to work in patients with polycystic ovaries who want to conceive, right? So the condition gives you this increase in insulin, the hair growth, the hair growth
Yes.
on the body, meaning around the nipples, up to your navel, acanthosis nigricans, big medical word, just so they get a little darkening around the neck, under the arms. You see that increase weight. Don't forget the acne, yes, but the hair loss, they do get hair loss, right? So these are some of the main things that are associated with it. But the periods themselves will become either absent or very prolonged, like the cycle from one to the next is a long time. You see
Wow.
that.
Is it preventable, or is it primarily
It's it's
genetic?
not really preventable. You might get it if you get it. Um, what you can do is the lifestyle change, everything that encourages you to not have the excess weight, from exercise to choosing the right foods more the fruits and vegetables, more peas, beans. These are the things that help. Um, low cholesterol level foods. That's the main thing, because people who have polycystic ovaries might and most likely end up with cardiovascular disease, ischemic heart disease. Yeah, that is one of the sequelae for it, and so you want to change your life once that happens. There is
Mm,
some amount of inflammation that takes place, which is why they also have a bit of insulin resistance, and this inflammation is improved as well when there's weight loss.
okay. Okay. I want to take the questions as they come. So Avril is saying, my daughter doesn't have any of the presenting symptoms, but she suffers from PCOS. Could there be other factors?
Well, it's very dynamic. Um, not everybody has the signs and symptoms. Some people had nothing at all. Some people have this presentation at this time in their life. Later on, they have something else.
Mhm.
It can be very subtle, and it can be all the signs. And the fact is, you can have cysts, but not the syndrome. Polycystic, having cysts on your ovaries does not mean that you have polycystic syndrome, because you have to have everything to have the
Okay.
syndrome.
Okay.
Yeah.
All right.
Yes.
Uh,
Hmm.
can it be
And
reversed?
well, as I say, not reversed, it can be improved. Okay, because we can control the ovarian function a little bit. We can tweak it with some hormonal therapy, and we can treat the ovaries. We can wedge section. Back in the day, they did it more than they do now, where you remove a portion of the ovary, and hopefully the regenerating part of the ovary will improve the whole situation. But we can drill now, do diathermy on the ovaries, on the cysts, and that helps with the ovarian function. So, yes, it can be helped and treated for a time. Sometimes we do it so that we can achieve a pregnancy,
Mm-hmm.
because you have to have a regularity of menses, some sort of ovulation going on, which doesn't happen with this. You know how we explain it? I use crabs in a barrel as an example. um, Everybody's in barrel and they want to get out, and everybody's falling out. So too in polycystic ovaries, you have all these cysts. You need one to develop properly and be released from the ovary, which is ovulation. But none of that is happening because there are so many, each of them jiggling, forcing each other. Nobody really wants to develop. No, not me, not you. And they can't, and it never happens. So ovulation is not happening. So we have a way of doing hormonal tests to find out what's going on in those ovaries, what's happening. Is it the brain sending bad messages to the ovary? Is it the ovary not producing properly? What's going on? And so we do those tests, and then we try to treat. Yeah.
Mm-hmm. How
Mm-hmm.
does PCOS impact mental health, and what support should women seek when if they feel like
Honestly, JL, anything that is chronic and difficult to treat, long lasting, is a frustration, and it can really significantly impact the mental health of a female patient. Um, Often that, and sometimes endometriosis, and of course, polycystic ovarian syndrome often impacts on a woman's desire for conception. That's
Mhm,
part of for most women in the world, conceiving and giving birth is a big deal, a desire, ultimate desire for so many. And anything that prevents that from happening can lead to depression, even decreased affect generally, problems in the workplace because they always have to be, or for having problems, difficulty with relationships because a relationship may not work. It's always assumed there that the female has the problem. So with that already on board, relationships often have a bit of a challenge. So anything that goes on for this long and can develop from the time they start seeing their periods onwards,
mhm,
because when mothers bring their children young in their teens to say, well, they haven't had a period yet or is irregular. Okay, I can for a while say that it's because they're not ovulating regularly because the whole body hasn't worked itself out yet. But the time will come when it is really maybe something going on with the ovary that we cannot necessarily fix yet. And so you have this problem going on for years. So the impact is great. I mean, if we had support groups,
I was about to
okay,
say,
we have a lupus group, for example. I mean, if there were support groups for every condition,
I think there's a
it would be.
PCOS support group. I think Trudy Christian um,
Oh, that is
does that.
correct.
Yes,
Yes,
yes, there's a
yes, yes.
PCOS support
I was
group.
trying to pull it into my brain. I thought, okay, I'd forgotten. Okay,
Yeah,
yeah.
there's one, and
There's someone
I'm
you can talk about your symptoms, talk about how to deal with it, and so then yeah, it helps.
do you, well,
But I want to say, but having polycystic ovarian syndrome doesn't mean that you may not conceive. You might, you might have to try harder than somebody else. You may have a lot of physician intervention or um, a high doctor patient interaction, but it is possible. It is possible. It might happen unawares, um, but or it might happen with planning. You
mhm,
know, one of the things that women always find it difficult to understand is that I have to sometimes stop the period, regularize it to the norm, and then assist them with ovulation. You see, this stopping the period and blocking off this, not everybody will grasp that and want that to be happening, but you have to explain that yes, it is something that we can do at the beginning. You haven't conceived for so long, let's try 3 months of that and see what happens. It can work.
So it's almost like you playing with inside there, like you
Yes.
test.
But you see, hormone, it's no exact science because small changes of hormones make a big difference,
Yes.
you know. So we just try. We just try.
Wow, wow. We want to switch it up. We want to switch it up a bit. We spoke a little, we talked on PCOS, and I feel like I am taking
Mm-hmm.
advantage of the doctor here because I want to talk about everything.
I
But
hear.
without talking about, like, we talk about PCOS, and obviously you mentioned menstrual cramps, you mentioned menstrual pains, you mentioned excessive bleeding during, for women who have PCOS,
Or long
just
cycles.
or long cycles is maybe some of the symptoms. But I am interested to know, and
Waiting.
I have an aunt, and I remember when I was about 16, she said to me, like, nobody's not supposed to know about your period. Like, nobody's not supposed to know you're on your period. You know, like, you're not supposed to tell people about you. That's a private matter, right? Why is it still so difficult for many women to talk openly about their menstrual health?
Um, I think it is the it's just an unsaid seems to be an unsaid taboo. I mean, it's okay. More and more people are. I mean, there's a mental health day,
Mm,
mental hygiene day. Imagine
mm,
there's a mental hygiene day. Isn't that wonderful? I'm not sure how it is played out, but it's recognized and it's very, very important. It's not a big secret because you have to talk about it for us to know what you experience, for you to know if it's okay, for us to help you with it, because menstrual hygiene is very important. Okay, knowing what to use, how to use it, are you accommodated in the society, at work, at home, wherever you go, at church. So we can talk a little bit about that, but it's people just don't want to talk about what affects women, and it's very important to talk
I
about what
know.
affects, you know.
Do you
So
like,
we're moving away from that.
in your opinion, though, when it concerns what we use during our periods, what would you say be best practices? Like, some women use tampons, some women use pads, some
Yes,
use cloth, some use the cups.
yes, yes.
The the period cup.
And the cups, that's what they call. Well, what you use depends on what you experience and what you feel comfortable with.
I can't
Okay,
do
so we start
tampons.
with
Like, no tampons.
so we start with the pads. So pads are the most
Mm,
commonly used. Um, you want to choose a pad based on what makes you comfortable. Some have wings, some have don't. Wings are to prevent your underwear from getting soiled. Some are long, some are short. What happens? How do you sleep? When you go to bed, you get up in the night to go to the bathroom. Would you change then? If you're going to have a long night, do you need a long, how absorbent it is? Those things decide what you use. Do you bleed heavily? How long do you bleed heavily for? So you might say, well, I have to change, or I might buy it long. So you have to make a choice of what you like. Not everybody likes tampons. If you wear a tampon, you have to remove it within 4 to 6 hours. You don't want to leave it then forget it. And
I
it
think
depends
nothing
on
does give me bad cramps. I think anytime you see tampons, just give me
why
bad.
you're not supposed to feel it. You're not supposed to feel it.
I
Once it's in there, you don't feel it.
Well, I doesn't feel the tampon, but I just feel the cramps. Right? I just feel the
I see.
cramps.
And you think it's because of the tampon?
Every time I wear a tampon, I get cramps. I get
Maybe
extreme.
you don't. You don't like the time.
Another thing too is, like, I find I don't like, I'm very particular about the types of pads. Like, if they have too much plastic in them, I'm not about that life. Like, if it's very
Yeah.
plasticky,
Well,
I find
you will know what it's like. Yes, and the absorbency is
yeah,
important.
yeah.
Yes.
And
But
period
they make more and more.
embarrasses me. And I'm saying to all of my followers, if you see me in Roseau and have a patch on my bottom, please come and tell me, because period. Just recently, I went to an event, and when I stood up in the chair, like, one of the girls, thank God,
Right.
wanted to big up yourself. Juanita was like, she came and she said, Jael, I think you may have messed up yourself. I was just like, bro, I just retweet. Like, what story that now?
I know. I know. Second form. Guess what? On sports day. Now we wear black pants. In back in my day, we wore white pleated skirts. But that time I had a jacket, so I just tied it around and tried to be a little trendy. but
That's
but it all
always
depends on the
embarrassing.
clothes. Yeah.
Always
So you
embarrassing.
want to advise people how often to change,
Mhm.
and what to wear like that. So they're generally effective if you can get them. I've not met anyone actually who uses the cup, but the tampon for
I've used the
sure
cup.
and the pads.
I've used the
Yes.
cup, and
Yes.
I absolutely love the cup. I
Okay.
love the cup. It is so like I've used it. I'm not using it currently, but I've used it for long periods of time. I feel it's
Mhm.
if you have clots, like if you're somebody that gets a lot of cramps, it reduces the cramps significantly because it drops right into the cup and it holds
I
eight
don't know why that should reduce the pain,
liters
because the
of
pain is from the clot coming through the cervix,
well
forcing itself out of the uterus that causes the pain.
it makes it just come off. Like it just come off. I guess because the cup goes in and it opens like because
Is
when you
under the cervix where it comes in.
like a little umbrella, like you open, but like an upside down umbrella.
Mhm.
So when you open it,
Yes,
it
yes,
just latches on the edges. So anything that comes on, it just comes down.
yes.
So I mean,
Mhm.
who knows? Who
Mm.
knows what's going on
What
with
works
this?
for you works for you, right?
Exactly.
But
Exactly.
I think that the hygiene is also about okay, so choosing the product, how you're going to dispose of the product. No, so for all the young people out there who are just starting to use pads and tampons and so on, um, you wrap it up in the plastic it came in, its casing, or in some tissue, and you throw it in a bin. It's not to be flushed, okay?
Let me
It's to
tell
be thrown in
you,
the bin.
I see some nastiness in public washrooms. And I'm like, them are not teaching them how to do this thing. Like, why do I see everything that's inside of the pad? Like
Yeah,
you
yeah,
first you
yes,
roll it up, then you take
yes,
what I do is I take the paper and then I roll it in it, and then I take
yes.
the casing from the new one and I roll it in it. Like there's no
Of
reason why this
course,
should be
of
open like
course,
it.
of course. The same way we get rid of
I find that
Pampers,
so
same way.
nasty.
Right? So we
Hmm.
have to get rid of it properly in a timely fashion as well. You don't want to keep them on too long. When you keep these things in too long, you get infection.
What's the
There
longest
is
time you should?
a bad odor, and everybody knows you will get a bad odor and an infection. So we don't want that to happen. The longest it should stay, I don't want to say the longest it should stay. I wouldn't leave it more than 6 to 8 hours. Sometimes you're forced to 8 hours, but not even as much as that. The overnight, whatever you use overnight, would be the longest time frame that you use.
Yes,
So that's what you would
yes,
do.
yes.
Their personal hygiene themselves, when your period is coming, or when it's there, there's a little bit slightly different body odor. So you want to be cognizant of that and careful with that. Um,
I actually like
Washing.
that odor.
It,
I don't know. It's
mm,
the odor I like. I do.
really
It's like
terrible.
I don't know. I think it's African in me,
You're a woman.
probably.
But
Yeah.
yes, and the fact that you clean, you've cleaned yourself very well and so on, you feel just fine. You just go on with your normal day-to-day activities. Use something that you know is not seen by someone else. Use dark underwear or appropriate underwear too, so that it's not seen, and move along with your day. Don't let that hold you back because you're having a period,
Personally, no,
you know
Doctor. Personally, I feel like we should be at home, sleeping with our feet up during those 5 days because
Oh Lord,
I'd
how
never
productive will
Dr. Roberts, I've never seen somebody get caught and they bleeding and they going to work. You ever see somebody cut their hand open or they have a cut and they bleeding and they going and work? No. Everybody go, they take time
well,
off. I don't
that's a normal physiological condition.
let me
So
tell
we are just to deal with it and manage it.
I want to stay at my home those 5 days
I wish I could put up my foot too.
and do nothing
Uh-huh.
because I am losing blood. Okay, I am losing blood. You can call it what you want to call it, but it's blood I losing, and it
But
drains my
uh
energy. I feel so drained, and I know a lot of women.
I feel that drain before it actually comes. The week before, I tend to something will always spark a note, and I thought I'll think, wait, something's going to happen next week because you do feel that fatigue. There's a lot going on in your body, a lot in preparation for and so on. So you do feel that fatigue, that the mood change. Sometimes it's a bit more in others than in others, but
I glad
um,
that up, you know why I glad you bring that up. We really, as women, we only have 1 week to ourselves because like in your scenario, for example, and some people are just like you. The week before you have period cramps, you feel different, your body feels drained. The week
mm,
of, you begin, you craving all kinds of koshoni, all kind of nonsense. You want to, that it happens. And then the week, and then soon after, you ovulating. It's like you don't have a break.
you want something else, but that's not that's not considered a break. It's just what you want. One time you want chocolate and ice cream,
We
the
don't
next
have
time
a
you want maybe. Anyway, we're beautifully made. That is for sure.
break.
Yes. Okay,
Wow.
and then just to mention, I mean, part of part of menstrual hygiene is having sanitation, having facility for women. So where you work and your church, where you frequent a bathroom in a supermarket, for example, the bathroom in a pharmacy, anywhere there's a public bathroom, maybe it should have at least a pad and a tampon, a choice, toilet paper,
We haven't we
you
just
know,
cut
just
off.
knowing that it's considered.
Yeah, we had some cut
Sorry.
off for 2 seconds. I don't know. The
All
internet is
right.
just internet in these. Yeah, but you were saying a
I
public.
was
Last
saying,
thing I heard was public.
yes, we should have facilities for women when we consider women and the fact that they are possibly going to be menstruating. So posh hotels and any hotel, as I said, church, supermarket, pharmacy, wherever, your workplace, school, there should be tampons available, pads available, toilet paper, possibly
All you hear
wipes.
that,
But
women?
it
Get all
should
your
be there
bosses to put that in
waiting
the
for you.
bathrooms.
Yes, you should have. And it's not to and respect it, ladies. I mean, sometimes we see something and we want to take it. No, it's not. It's for somebody to have the opportunity to use it. Especially sometimes we're caught in a compromising situation. You know, you want to be able to change or so.
Well, in Canada, they've actually developed that where all washrooms have that now, including
Of
schools,
course, women have
public
to
washrooms.
consider.
Public washrooms in Canada kind of bougie still. So their washrooms are just so bougie. They have his and her washroom, they have family washroom.
Only
So
his and her.
you can say that again.
Only his and her.
My bad. He's her
I'm
and
just being
and
awesome.
and them they and all of
They
that,
wouldn't be able to have enough
including.
bathrooms.
Yes,
Yes.
yes. So they have like I think the family bathroom or washroom is where people who identify differently use,
Yes.
so or and it's also used for women who are breastfeeding. There's actually one of the malls I absolutely love because you go in and you go into the bathroom and they have the washroom and they have everything set up, including couch for if you have to breastfeed, and they have all kinds of stuff. I'm like, why they so bougie? OMG, right? One day, Dominica will get like this. But yeah, so I want to touch a little bit on um fibroids because that is the fibroids is a situation that I don't know if it's
Can
a
I just say something before?
situation.
Because
It is something that is affecting
Jael,
a lot of women and is destroying
Jael,
a lot of women. Yes,
can I just mention though, because you had asked me what for parents, you had asked me a question, if I could highlight it to the parents, what we would say
sure,
to young people um, with respect to
sure.
menstrual hygiene. And I think this the most important thing is for parents to be open with their children, to giving them the information that they need, and not all in one nugget. Some today, some another time, because they don't want to hear everything one time. You know, if they're like my daughter, they don't hear anything at all. but you have to keep the lines open, and don't be afraid to talk about it, like your aunt back in the day, you know. And
Uh,
some people back in the day, they were uncomfortable talking about it. I always make the joke about myself. And I was visiting my grandmother in the country, and I got my period of all the times. And it was the day before I think I was going to go back down to town to my other granny. And I'm a granny's girl. And the granny in the country said, "Your granny in town will talk to you." And when I got to town, my granny in town said, "Don't talk to boys." And so, God rest her soul. But conversation has to be had, and you keep the lines of communication open, and break it down. Let them know everything as possible that you can. It's not a shame, nothing to be ashamed about.
and talk to the boys too. Talk to your boys too. Like it's not just the girls. Talk to the boys are aware, so that when they do see, because they can experience it where they see women or young girls, they have a mark on their clothes, and instead
Yes,
of giggling and try to
yes,
protect
yes,
them, And I
yes.
mean, I've told my boy all the time, and he knows, eh? I just make him go and get my pads for me. I just make him, yes, he know
And
everything
that's
he
more
needs
adult,
to
yeah,
know
but
because
in the
I feel
teen time, at the teens, they're so sensitive about everything, especially that. So the slightest look might cause a big, yeah, something.
Mhm, mhm. Yes.
So tell
Let's
me
talk
now, what
about let's talk about fibroids.
cancers, cancers, fibroids. Okay, what do you want to
So
know?
we know,
So,
like,
so, so, so
how
common.
do
One
I
in
like,
three black women again.
but why it's women? Why other women not getting it like black women?
They are, but black women are just getting it more. And we don't seem to get puny, little fibroids. I mean, more commonly we get big fibroids. And I think it's because, thank you, women don't go to their physician when they notice a slight something in their menstrual cycle, a slight change, or they don't notice that their stomach is getting bigger. They just find I'm exercising, but my stomach wouldn't go down. But that's a secondary thought. They're not thinking about that. They're not thinking about the period is lasting longer, because that's a significant point. The period used to be 5 days, maybe seven. Now it's 14, or it's 21, or it's not stopping. Or after intercourse, I'm bleeding, or I'm producing clots, or there's a bad, slimy or malodorous type of discharge, or as if I'm going to the bathroom more often, I'm wee-weeing more, well, peeing more, they say. I really cannot say that word. All my friends would just roll their eyes, of course. Um, they
Hmm.
become constipated. Yeah, something is
Hmm.
happening that's a bit different that we just overlook, and we. I'm not saying that you cannot wait and observe something to see what's the trend, what's happening, but these are the things that happen a lot when people have fibroids. I mean, gynae disorders uh, they overlap a lot. But with the physician,
Hmm.
unlike Google, we're here to use all our senses. We look at you when you come
Hmm.
into us. So if you're bleeding a lot, your eyes are pale, your lips are pale, you look pale, you even look breathless sometimes. We look at you, we listen to you, we listen to what you're saying, we put your story together. What you're not saying, we put that together too. We touch you, we feel, we smell, because sometimes, especially in advanced some diseases, there is a smell that if you are looking for it or anticipating it and the possibility of it, you'll figure it. So we use
Hmm.
our senses to figure out what's going on with you and to advise you and guide you what to do next. Google can't do that. Google just run down some things that are possible, but Google can't do all those things,
Right.
you know?
Right. Now, fibroids, like when do will you find women start getting, I don't know if I should say getting fibroids, or like, is it prevalent in women during a specific age range, or is it, or
Reproductive age
any
is
anyone?
always reproductive age primarily, because you should not be producing and making fibroids postmenopausally. Yeah, so it's in the reproductive age. So you develop the fibroids. They're not cancerous. Less than 1% are cancerous, but they produce all different symptoms depending on where they are, how big they are, um, and what it is that you want. Because sometimes they could be blocking a tube and you want to conceive and you find out you have a fibroid. So fibroids can be small and cause a lot of problems. They can be big and you never notice. They can lead to
Mm.
DVTs. We have a lot of DVT, deep vein thrombosis, blood clots, we call it. Yeah. When you have a big mass in your pelvis, the blood flow from your feet up, your blood circulates from your heart up your head, down your body, down your feet, come back up. The mass that is in your pelvis will slow that down or restrict that. So blood accumulates, blood settles, a little bit of trauma on the blood vessel, and boom, you develop a clot. When you come to me to remove that mass, the clot can move. So just having that mass undealt with for so long can predispose you to a clot.
Mm.
Mm.
I I have a question on the live, so I wanna. Melissa is asking: is the food that we eat and we don't exercise? Is the food that we eat and we don't exercise enough? Like, I don't know if she was referring to fibroids or
Is it
menstruation.
food?
I'm not sure
There
where
is,
the top.
but there is no real straightforward thing about what we eat. I mean, it's just perceived that if we eat healthily, we do better, right? There's no set thing about the foods that we eat. The other part of the question was what?
Well, she was asking about we don't exercise enough. Is that, don't exercise enough? Is the
Yeah,
food? It might have been
that
connected. That might question have been connected to
was
menstrual
before.
cramps.
Yes, yes, yeah, yeah. And there are lots of
Um,
ways to deal with fibroids, but once they're big, depending on what else you have going on, you end up having open surgery.
multiple times
It's
for some
beautiful.
people.
It's beautiful to take out that big fibroid or all of those. Whatever you see on the ultrasound, there's usually more to take that out and get rid of that problem for a patient. It's really, really nice. A person might do, if you take out only the fibroids, it depends on what you want in life. If you want to conceive again, that's what you're doing. If you're reaching the age where um, you're not having babies anymore, and the fibroids are still giving you a problem, or you have some abnormal bleeding or something wrong that you cannot attribute just to the fibroids or not, and you take it out, you take out the womb so that the fibroids don't come back.
Mm. But for some women though, they feel like taking out their womb
I know.
is like makes
They don't think
like
that
it's
they'll be
almost
a
like you're
baby.
taking away their womanhood
Yes.
from them.
The most comforting thing I can say to a patient, you can never change who you are. You are a woman, you're a woman. A uterus is simply an organ for childbearing, nothing else. It is useful for nothing else. Can you feel where your uterus is? You can't feel where it is. It's there in your pelvis. You don't feel it on a day-to-day basis like you feel your boobs or you feel your arms. So when it's gone, it's just gone.
Me, woke up first thing, we
So
had
try to put it like that, and it doesn't affect. I've never had a patient who says, they say that a lot, when they have a hysterectomy or they remove their uterus, sex won't be good anymore. Rubbish, beaties. The sex is as good as the relationship is before and after, and many times better. So it's no, 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 no.
I always thought that, oh, if you remove your womb, you will not be able to come again.
Hmm.
Like these things,
That's
like
from all
it
accounts.
just.
I still have my uterus, but from all accounts, no, that's not true. The uterus, my son is laughing. You see, careful who is watching your program. um, the cervix produces secretions that are helpful for intercourse, yes. But there are other glands that are secretory that assist in that process. So the better thing, if you're taking out the uterus, the better thing is to take out everything, unless there is some reason why you cannot take out the cervix. And then sex is just normal. Everything gets back to normal. Give the lady some time to recover. Don't pressure her too much, and slowly you get back into it, and it's fine. I'm sounding blasé. Are you there? We have some internet problems. Jael, Jael. I'm out too.
I lost you for a second, Dr. Roberts. I don't know. The internet
There,
is
we having some issues. No,
we're having some issues. I don't
I
know.
don't want to sound blasé. I want to make sure everyone understands. I'm not being blasé about it or casual or
Okay.
insensitive. I really want to reassure ladies that everything works out very well. Very well. It's the last show. That's what happens. It's the last show for the season. Mhm.
Okay, guys, I'm so sorry, but we seem to be having some technical issues. I don't know what's going on. The internet is being a mess. I don't know. Dr. Roberts, you're there
Yeah.
still? I'm actually
I
using my data
I have
because
wonderful. Pardon me.
I'm using my data because the internet is just not working properly.
I'm sorry.
Yeah. It's okay. We on. That happens. I apologize to you and to everyone who's watching. Sometimes these things happen and we just try to roll with the punches as much as we can. I mean, I have no
It's
control over the internet. I can't go in the, you know,
I'm
um,
right
I'm
over
using
my
my hot.
head.
I'm using my hotspot. Hopefully, it should work and we should be good for the duration. The last thing we're talking about, and you may have said it, but I would have completely missed it because my internet
Okay.
had probably
I'm
was
over
probably
talking.
No, 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 you're not. The last thing you were speaking about, you were actually talking about how things work out when you remove your womb, and then the last thing I said was, I always thought that removing your womb would cause,
Affecting sexual function and
yes,
enjoyment.
yes.
No, no. The good thing is the pathology has been removed. Whatever is causing the problem, whatever the problem is, has stopped. This abnormal bleeding or this big mass you've been carrying, or this big pain that you have had, this frequent you going to the bathroom, this delayed stooling, passing stool, this delay, all done, right? And no periods anymore. No periods anymore. It's not wonderful,
Well, I don't have issues with fibroids, so
right?
I still find like some people experience it at such a young age, even before they have kids. Like, what would you like? What really is causing this? Because some people say it's the food we eat. Some people say it's like what is causing these things, and
We
why
don't
is it?
know. We don't know. We don't know. We just know how to help to fix it. You see, hormones are contributing to all of that. Yes, um, because of this, maybe this dysfunction that's going on in our bodies. Yes, because it's developing from the uterine tissue, but there's no, you're just going to have it or not going to have it. There's nothing that you can necessarily do to prevent it. But the only baseline stand across the board advice is healthy eating, healthy lifestyle. All of this reduces illness, it reduces it. And that's it.
What are your thoughts on milk, cow's milk?
Too everything, too rich. Mm-mm. Dairy. Mm-mm. Too much. None of that is recommended.
Yeah, because a friend of mine told me years ago to stop, well, encouraged me to stop drinking dairy, milk, stop drinking milk, stop taking like any milk products, like ice cream, all of the above. I didn't stop cold turkey with the ice cream, like every now and again, but then
Of course.
something seems to be happening that as soon as you hit 40, I found that I started to get lactose intolerant. And like I would get like really bad pains when I had milk. So I was like, you know what, it's just best I just stop it altogether. And once I stopped drinking cow's milk, my skin started to change.
Yes, so all these milk products, and so as it's very good to stop, and it helps with acne and all these kind of things. Yes, but there's no set. Yes, it's done. They see it a lot. Yes, it seems to work and be helpful, but we don't really know why and how. Right?
Wow. Wow. Now, um in terms of you talk about like fibroids, and in terms of how we kind of maintain healthy lifestyle, healthy eating in order for us to prevent it. But are there any other things that we can do for people who are experiencing, people who've had it like multiple? Like I know of people.
Don't. Your fibroid former. If you have it, you are a fibroid former. Some people might have a fibroid 1 little centimeter, 2 little centimeters all their life, and others will have it 17 centimeters, or 24 week, 26-month-old baby, 6 month intrauterine baby size, and that's what they do. You remove it, and they might. There's one case I know where I took out so many fibroids, and 6 months later, she had more again. That is my biggest shock to this day. And I can see the patient, I can see her name, I can see her face, everything. That was unusual for me. But if you're going to remove fibroids, we advise the patient, if you want to conceive, try to do so within 18 months, not before. We don't want you to be laboring before the 18 months. We don't want you
Before
having to
what?
end up with
Before
or
surgery, or
something.
before what?
Once you take out the fibroids, once you do that surgery,
Hmm.
we want you to wait a year and a half. So that's why you have to think about what you want to do when you want to do it, because all of that interplays with your decision. How bad the symptoms are, when should I take it out, if I make more, what's my time difference, how many children do I want. We have to consider all of that.
That thing's on diab. That fibroid story is I know we have, we have lots of other things that we can ask tonight, Dr. Roberts, but I don't want to keep you here any longer. And I know folks will probably want you here longer so they can ask questions or so they can. I really want to know if we can have you on again. I kind of want to ask you. I put you on the
Also,
spotlight. Hmm?
because we still have a couple of little things, some things I like to talk about. Cancer, I
Yeah.
love to talk about that with my ladies. So yes, I can come back. They
Yes.
ask me nice.
Would love to have you back. I'm hoping that I could do a little health series in September, and we can, because September is known as Health and Wellness Month. And it would be good if we can get you on, so save us a spot in your life in September. So, because I know you're very busy, and I don't like to, this is like taking out of your time and your time with your family. And
It's a pleasure to share. It's a pleasure to share. Yes, it takes time, but everybody's doing their own thing. Mommy's here on the TV, on the radio, on the computer, so it's fine. It's fine. It's a pleasure to share my information, what I know. That's what I do every day.
we really want to get you back on here again. I don't know if it will be exactly in this format because me and my creativity, I probably switch things up when the season comes about. We're not really telling anybody nothing, but we definitely would love to have you back. I think you are a wealth of knowledge, and I love the fact that you are willing to offer, to give give the advice and educate our public. Somebody asked, say, next season can Dr. Roberts talk about menopause? So women want to know next season though, menopause. Do you see it says
Cancer.
menstruation, menopause is men. It's all men things. Men things. Men
No,
feel
man,
they
don't focus on the men. No, 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 no. Just it's
cancer, cervix, a lot of women, and they suffer in silence and they die. Just the other day, we heard of a woman who passed away. Nobody knew she was sick. She
But
just,
the most common cancers in women are not cervix.
what is it?
They are they are breast, yes, but lungs and colon.
Why lungs
If
and
you're talking
colon?
about if you're talking about gynae cancers, then you're talking about cervix, ovarian, uterus,
Mhm.
um, and the other organs. But cervical is not the most common, eh? Um, and you know why? Because we have screening. We have a good screening program. We have a good screening program for cervical cancer. So even if we like to say, okay, so there's so much to talk about for cervical cancer,
No.
you know, but we have a good screening program. I want to say that we have 7 health districts and we have like 48, 50 health centers.
Mm.
People are told about pap smears. Pap smears are really important about finding out if there's anything wrong with the cervix that might increase your risk of becoming getting cancer. It's not to take everything and be worried about everything. Everything is not a big worry.
Okay.
Things require observation, things require investigation, something
We lost your audio.
screening.
Sorry. You accidentally muted yourself.
It's okay.
It's okay now.
Right. If you're not going to the doctor and doing your pap smears, which of course are not painful, I say time and time again, it's not painful. It's a
That
little
thing,
brush. It's not painful.
and it feels like they're scratching.
It's
It feels
not.
like a
Is
cat
that how it feels when I do the pap smear,
on
Jael? Is
your
it?
inside. Not when you do mine. When I've done it,
Okay.
because you special, which I clearly
Yes.
stated. Okay, but I've had in the past where I feel like it's a cat got the holding onto my skin and scratching it. That's how it felt like.
I'm sorry for that feeling, but it's really not and nothing pleases me more. It's really not painful. Nothing pleases me more than to tell a patient, yes, you need to be getting a pap smear. It's going to be such and such. It's done for this reason, and I'm finished talking, and the pap smear is done. Doctor, you need the
I
pap
like
smear?
that.
Yes.
I like that
Just
you
lovely.
talk. You keep us distracted. But you're an exception to the norm.
But not to take away from it, pap smear is extremely important. Once you are sexually active, you need to do your pap smears. If you're under the age of 30, every 2 years. If you're over 30, every year. Because if I say every 2 years, every 3 years, you're going to forget. There are some first world countries that say every 3 years.
3
We
years, yeah,
have
in
a
Canada.
modified sort of regime that we use, and for us, our people, our black people here in the Caribbean, let's do every year from 30.
What are
When
you
you get
trying
to
to say?
60,
We're more
up,
sexually
once
active.
you
We hyper. We
know,
hypersexual.
I am saying that is when to check. You see, HPV is a significant part of cervical cancer. What will reduce that is if we reduce our exposure to HPV too early. We can talk about that later, fine. But we need to give the body some time to recover if there's anything a little bit off, because our immune system has to be boosted and we can help to cure certain things that are going on. So we have an interval time at which we do our pap smears. So don't say, oh, I don't want to go, I don't want to go. Go, get them done, get your results, reassure yourself, and do it the next time you have to do it, and
Is
move
it
right
done?
along.
Is it for
So
free?
that's
Is it
why
done
our
for free
oh,
at the health
sorry,
districts?
you didn't know. That's why
Okay.
that's why we're not getting to that point. A few will, but for
Hmm.
the most part, we screen.
Would you say in
I'm not
Dominica?
hearing you, Jael.
I don't know. I'm on. I'm on. I don't know. You hear me?
Not
You hear
hearing
me?
you at all.
I'm on. I'm here.
Okay, I found this on the web for you. CHPV is a significant part of cervical
I'm
cancer.
here.
What will reduce it is if we reduce exposure to HPC too early, we can talk
Okay, I'm here. Refresh yourself, Dr. Roberts. Like refresh. If you have
about.
another
I'm going on. So we
if you
have at
have
least
you have
we
another
draw
audio
smears
playing in
to
your back,
say I don't want to go,
you
I
have
don't
another
want to go,
audio
go
playing
get
in your back.
them done.
Yeah, so I just muted you because you have another audio playing in your background. So it's probably something that just that took over your audio.
So on, so
Yes.
you know,
Yes.
my
You
son
hear
is
me now?
keeping it.
You
I
hear
am
me?
hearing
You
you
hear me
now.
now? Fantastic, wonderful. Thank you, son.
Thank you, son.
Yes, there was an audio that took over your background. But
Sorry.
my question was around the lines of um yes, Siri does that. Let me tell you, you have to let me that's why I put my like if you Siri will come on and will start
I don't
putting
know what
things
I
up.
touched, how I did that. Yeah,
Yeah, it put up something saying HPV is caused because you're talking about HPV, so it just
I
find it
know.
and start, let me tell you your business, oh, just on your business on the internet, see? But my question for you is along the lines of Dominica and health centers and whether or not pap smears are done for free, and that's my question.
As far as I know, yes,
Okay.
they are.
I wanted to know because people might say, well, Dr. Roberts, can't really afford, $150, $120 to come and see you to do my pap smear once a year. But I can probably go to my health center in the health district and get it.
Absolutely, absolutely.
Yeah.
Everybody knows about pap smears. If you're not doing your pap smears because you don't want to do your pap smear,
Hmm.
the system is fantastic. The nurses go out, the doctors at the health center, they talk about pap smears. There's a special day maybe scheduled for pap smears to be done. And the only thing, sometimes results take a little bit of time, but you will get your results, and it is to be interpreted properly. And remember, on most pap smears, no abnormal cells means normal. Other things are on a pap smear that are important, yes, but sometimes we worry about the other little stuff that is not so important, and we're having palpitations, we can't eat our lunch, we're afraid to come to me, our pressure is up. That's what I want to avoid. But I want you all to, I want us as women to do our pap smears. I mean, the relief you feel when you've gone to your doctor and you've done your pap smear. Even me, I get busy. I'm dealing with patients all the time, and I say, boy, I have to do it. To do this month. Oh, this month it missed, and oh, I don't want to go another month. I just have to walk across the corridor and get it done. But sometimes, I miss, and so. But once it's done, oh, the relief. Of course, I've done my smear. Yeah. So we want to keep checking. We don't want any surprises.
Mhm. Everything to do with your cocoa, Dr. Roberts is the one.
I
Everything
do
to
not
do.
have any cocoa.
The other day, I did a video, on pads for your cocoa. The video went viral. I don't even understand. Everybody was loving it. People meeting me on the road and they'd be like, Jill, I gone by the party for my cocoa. I was like, oh my God.
Oh Lord have mercy.
Well, I mean, it's for if it's for. I mean, we made talking about our vagina and menstruation and those things. So, or not we've made. No, we've met it that way. We met it that way where
Yeah, we
people we
make
gonna talk about it, and I'm
it.
like, there's nothing to hide. I used to follow this lady
Yes, but
years
I
ago.
but for me, I'm a person. I just use the right word. My children don't talk about cocoa or anything. They
Coco.
talk
No,
about
I like
vagina.
I like Coco because it makes it playful. It's like a playful name, and it's not like I'm scared to say vagina. I have no problem
Of
with
course.
vagina, but I'll just say, apart for your Coco, okay. It makes it more playful, and it makes people
Yeah,
feel less intimidated by the
yeah,
word vagina.
yeah.
Because it just sounds like this big word. But Dr.
I
Roberts,
understand.
I really, we've already made a date for September. So much take note. We've made a date for September. He will
You're
send you.
bullying me into September. No, I'm just joking. I'm just joking. Overused term, but yeah, I'm just joking.
Bully? What bully? We would
Yeah.
absolutely love to have you on. We want to talk about cancer, so we're making a note of that. We want to talk about cancer. We want to talk about. You said something else that we want to talk about. You said something else.
What did I?
No, you said something
Did
else that you want. HPV.
I HPV? Oh yes, yes, yes,
Yeah, we want to talk
yes.
some more about HPV. We want to talk about just general health of our vagina, and
That's right.
that sort of conversation. And we hope that we can have you back in September. I am so happy that you were able to come on this evening. Thank you very
Yes.
much for always being so lovely, Dr. Roberts, and being so pleasant and sharing with us. We truly appreciate your time. We appreciate your expertise, and I'm very happy that you were able to come on. And I know some women are sitting there in silence and they're not saying anything, they're not asking any questions, but they're more than happy. Let the doctor know that you all were happy. I know people like Tara is very happy, that she could come on and get the information. And I think there's somebody by the name of KK,
Oh, that's my
Melissa.
friend.
They're on. They're on, and they're very happy that she could come on and
It's
share.
a
And I
pleasure. It's a pleasure.
I hope that those of
I'm
you who
shy,
are you
when
shy,
I think about
not
women,
not
I'm
with
shy.
not with me, not with
But
me.
I'm talking about what I do every day and what I have to say to a patient anyway. So we try to fit as much as we can in our 20 minutes. Maybe I talk too much. Maybe sometimes it goes on for an hour. Sometimes the patient is in there for an hour. Whatever is necessary, but I'll do it. So
Yes,
I come to
and
you.
don't be afraid if you go visit Dr. Roberts. Take a note of everything you want to talk about. I do that. She don't know that, but I put up my notepad of everything that I
Yes,
want to talk about.
I
I have
have
all my
motivation to do that.
make a because
That's good.
sometimes you're there and you're talking to your doctor, and you forget certain things that you wanted to talk about or you wanted to ask, or you probably had a pain but you're not feeling that pain on that day, and
So you
you're
forget
like,
to ask about it.
you forget to ask about it.
That's about I try to squeeze something in there. That's the thing about ovulation. I don't think we've realized that ovulation pain is uncomfortable. Sometimes it's sharp. Sometimes it goes right down in your cocoa, and you sit and it feels painful. Or it's all of a sudden sharp. You have to hold your side, but it does not last forever. It comes, and there's a heaviness in your back. That's what ovulation is. But you will realize that you feel it another month again, and you're otherwise quite fine. So that's what ovulation pain is. Sometimes we don't know what that pain is, but don't dismiss it. You know, it can be something serious.
Yes,
Okay,
definitely.
I should go
Make a list
send him.
for Dr. Roberts. Go and see her. And bring all your questions if you miss anything. And those of you, because
818-7511. Let me do like you. 818-511.
shameless
So you
plug.
can make an appointment.
Yes,
Should
yes.
I do
It's
that?
one eight
That was
seven five
appropriate.
one.
That was inappropriate.
That was very appropriate because they're gonna slide into my DM and ask
Oh, I
me.
work at the hospital too, you know. I work at the hospital too.
They will slide in my DMs and they'll ask me what is Dr. Roberts' contact number. So I glad you say it.
The local epic number is not to say it's like a foreign number. A
I
machine will
glad
say
you say it.
your personal line. Talk to the secretary.
Right, right, right. That is it. Smooth and easy, like they say. Thank you again,
Mm.
Dr. Roberts, for coming in. It was a pleasure having you on here. And I wish you a wonderful evening. And thanks for being my final guest and being so graceful, even
An
about the internet
honor.
glitches,
An honor. Oh my gosh.
because the internet does glitches as annoy some people, eh? And you were so graceful, and I truly appreciate you for stopping by. You're my final guest for the season. All right. So take care. Bye
Bye
bye.
bye. Bye, Dominican ladies. Bye.
All right, guys, that's it. That was it. Our season is done. This season is done. Oh my God. What did you guys learn this season? What did you guys enjoy most about this season? What are some of the guests that you want me to bring back? Who you want to see back? Who you want to see come back here? Or what topics you want me to bring on next season? Who you love to see on? Yeah, let me know. Drop a comment in the comment section. Samaj will be Marco in the comment section. Trust and believe, okay? As well as I. And we would love to hear from you. We love to your recommendations. We know there are a lot of issues social issues that may bother you, or you may be affected by, and you don't feel like you are getting the answers that you need, and you want us to talk about it. Let us know, right? You can send us a direct message. You can also email us. My email is actually jael@jaeljoseph.com. Like, it don't get easier than that. jael@jaeljoseph.com. You can send us an email. You can, and we're pretty, I think we're good enough. We're pretty quick in answering emails and stuff. You can also send us a WhatsApp. And the WhatsApp is 767-315-JAEL. That's 5235. All right. 767-315-5235 or 315-JAEL. Send us a message. Let us know. I'm happy that you guys stayed with me throughout the season. Thank you so very much. We're always trying to improve our programming. Some things I really couldn't stand about this season was the internet interruptions. I don't know, I need to do something about this internet service. Probably need to get a dedicated line or something. I did get an extender. I've tried everything. Now I'm on my hotspot and you see it playing so clean. So data works so clean. That's when me, I'm up my data. I want to say thank you very much to all of the guests who came on during this season. It was so wonderful to have you guys on. I don't think we're going to take a long break. I feel like Samaj already has something lined up for July. Normally, I take July and August off and I come back closer to September. But we want to keep rolling. We want to keep going. And we're coming up soon with another season. And I want to say thank you very much to all those of you who followed, those of you who shared the lives, those of you who love the shows, those of you who subscribe to my YouTube channel, subscribe to the YouTube channel, because you probably will come on here and you will say, but hey, Jael don't have any shows anymore, and it might just be on YouTube and you're losing out. So it's pinned on here. It's Jael. It's youtube.com/Jael Joseph. You can search me on Facebook, on YouTube, and just subscribe, hit follow, subscribe, turn on your notifications, and whenever I go live, you'll be the first one to know. All right, guys. Thank you very much to my sponsors. Those of you who sponsored me during this last season. Those of you who have trusted me with your money, your business, I truly appreciate you guys, every single one of you. You know, those who write for me as an ambassador, as well as those who come on frequently or whenever they see the need to, based on their business needs and requirements. I truly appreciate every single one of you. You could go anywhere else, but you choose to come right here. And for that, I truly appreciate you. Thanks to the viewers, Glenda, big up yourself. Tara does be on Facebook. Tara, how do you do it? How are you on Facebook and YouTube at the same time? I don't understand. You have how much you have your TV, probably have it on, and you probably have it on your phone. What's going on, Tara? Tara is a diehard. Tara and I met. People must be wondering, but who is that Tara? Tara does stop down jail. Tara and I share a goddaughter, and that's when we first met, right? And we have been friends ever since. So it's been 16 years of friendship. We can actually count we know the years because we share a goddaughter, and I absolutely love Tara, and Tara has been there through thick and thin, and always on the live, sharing and showing support. Truly appreciate, and all of those of you. I mean, I'm singling out Tara because Tara, I know she's my bonjour, but some of you have, we've grown closer over the last season. Um, you followed me for the first time. You've enjoyed my programming for the first time, and some of you have been here since I started going live on this show, and I started back in 2018, right? So we've been doing this for a while, right? Since 2018, and I'm so happy that you guys trusted me with your guests, with your thoughts, because when we talk to you, you go and you think about it, right? So you're trusting me with your mind, and you enjoy our guests, and I want to say thank you in a huge way to Samaj. Samaj, he said I just graduate Samaj to produce. I'm like, you're gonna produce the show. I literally put him in the water and tell him, I put him in the sea and tell him you have to swim or you sink. And Samaj grabbed the bull by its horn and he was like, Jael, I'm going to do this. And I really appreciate all of these efforts from sponsorships, the guests, you name it. He definitely has it covered. Sometimes I just have to come on here and just I truly appreciate so much for that. So thank you so very much, my team. I want to big up Monica. Thank you very much to you, Monica, my graphic designer. She's the one behind all of the graphics. We create nice templates, and we're able to somebody actually Dr. Roberts say, oh, we fast. We fast in producing those flyers. We don't play, right? You can have you send us the picture, no, we can have the flyer for you in 3 seconds. Right? That's how quick we be, right? And I truly appreciate my team, my sister Aurel, my biggest cheerleader. Let me tell you, big up to her again, for just graduating with her master's. I really want to say thank you to her for she always, sometimes I just forget to share. I just forget to share the flyer in my stories, and she'll share it for me and tag me for me to share it. So big up to Aurel and my kids. Thank you very much, Giovanni and Jazz, for being so understanding. Let me tell you, when you have 2 young children who are understanding of the work that you do, and they can be quiet when you are supposed to be on live and stuff, that really means the world to me. I want to say thank you to them. Thanks to their dad, for all of the support throughout the years. I appreciate every single one of you, my family, my friends. Yeah, man. Thanks. Love you guys. Until next season. Bye for now. Bye-bye.